matter experts who will share their knowledge and expertise as well as key information regarding the subject matter. We will hear from Daniel Feliciano, who is from the New York Regional Office. He will discuss claims processing as it relates to MST Claims, followed by Dr. Susan Black, who will share information regarding wellness and resiliency. And then we will hear from Scott Dadaian from the Sea Caucus Vet Center, and he will discuss vet center resources that are available to veterans and their dependents. Without any further ado, I'm going to turn the program over to Daniel Feliciano from the New York Regional Office. Daniel, the floor is yours.
Hi, good evening. Thank you very much. We can get the slides. Thank you very much. Good evening. My name is Daniel Feliciano. I was a VSR with the New York Regional Office. I became the MST coordinator when we revamped the program back in 2019. Since then, I've been working with the team at the New York Regional Office. We are one of the 8 regional offices that do work MST claims. And we look forward to continuing to better the process to work with our veterans with these extremely sensitive cases. So I'm just going to talk a little bit about what we look for in MST claims, what an MST claim actually is, and some of the things that relate to military sexual trauma.
Keep going. Liz, next slide. Next slide. Okay, next slide.
Hey, the meeting is starting.
Ms. Myers, do you want me to cover this?
No, it's okay.
Okay. Oh, there we go. Thank you very
Okay.
much.
Okay.
Okay, thank you. So MST is short for military sexual trauma. And what that is, it's just a subset of personal trauma that refers to sexual harassment, sexual assault, or rape that occurs in a military setting. So what's specific to military sexual trauma is it has to be a sexual act referred with this type of trauma. So, excuse me, as you can see, we have 3 subsets. We have military sexual trauma, PTSD personal trauma, and non-PTSD personal trauma. So if you did suffer a personal trauma, but it wasn't sexual in nature, it wouldn't be labeled as MST, but we would still work the claim as one of these subsets. So it might fall into personal trauma, which was PTSD resulting from a non-sexual personal trauma, or we have non-PTSD personal trauma, which is any condition, mental or physical other than PTSD resulting from a non-sexual personal trauma. So the key to MST is it has to be sexual of nature, and that sexual could be sexual harassment in the form of verbal sexual harassment, which would be, inappropriate things said to you while you were on active duty, sexual harassment, inappropriate touching, and of course, rape. Next slide, please. Try to minimize this 1 second. Sorry. Here we go. So when we process or when we receive a claim for PTSD based on military sexual trauma, it has to be due to an in-service personal trauma, and we undertake the required development for credible evidence to support the veteran's assertion that that stressful situation occurred. So a couple key things here is that the event has to be in service. That means it has to have happened while you were either on active duty, or if you are a reservist. I'm sorry, my view changed. If you're a reservist while you were at a drill weekend, or coming to or leaving from your drill weekend, we can also work those kind of cases. If it happened prior to military service or anytime after military service, it wouldn't be considered an in-service stressor. So we would not be able to work that as a military sexual trauma case. Okay. And something that we do identify is that it is very personal and traumatizing to speak about these events. So we try to make it as passionate to the veteran in the way we request the information. And all the MST claims processors do receive training on how to request this information and work these cases. One important thing to remember is identifying possible sources of evidence to support the claim may require asking the veteran information concerning the traumatic event. Make the request passionately as possible in order to avoid causing further trauma. So again, we do realize that this is a very sensitive situation, and we do try our best not to aggravate any of the veterans who have been through this process. Next slide, please. Thank you. Some of the forms we need, the first two I'm going to mention are a requirement. If we do not receive these forms, then we cannot take your claim. The first one is the claim for application, the 526 EZ. The second one is the 0781. And what that is, that's a form that you detail the event that happened to the best of your ability, to the best of your knowledge. Again, we know it's very traumatic. Just remember that all the information that you can provide to us is only going to help you when we look for evidence to support this claim. So remember, keep in mind the first two forms, we need them. We cannot work the claim without them. These next three forms, they're optional. You may not have them. You may not know if you have them or if you need them. You can send them to us. We'll ask you for them. If you don't have them, you can tell us you don't have them, and that's fine. The DD form 2910 and 2911, victim reporting forms. That's if you reported the incident while you were on active duty, or if you reserve on your drill weekend, you reported it to SARC or CID or the authorities. You would fill out this form and they would have it on record. If you have a copy of it, you can submit it to us. If you know you completed one and you needed us to get it for you, we can do that. You would have to submit the 4142 authorization of consent and release, and you give that to us, and we can get that form on your behalf. The 4138 is a statement in support of claim. If you have anything extra you want to say that maybe you didn't put on the 0781, you can put on that. If you have any other evidence that you identified, you can put it on this form and we'll look for it on your behalf. If you have a family friend or a relative or someone you in the service with that wants to write a statement in support of your claim, they can do it on this form and you just submit it to us and we can use that as a part of your claim to substantiate it. Next slide, please. Thank you. Again, this just talks about the process in which we work the claim and gather evidence to help substantiate your claim. And again, it's highlighted that it needs to be an in-service personal trauma, which means you have to be on active duty or on one of your drill weekends or your 2 weeks, which is AT. I think someone said they were still writing down all the forms. Can we go back one slide? Sorry. There you go. So remember, the first two are mandatory. The next three are optional. If you have them, great. If you don't, it won't hinder you in any way, shape, or form. Okay, great. You're welcome. Next slide, please. Okay, so you submit your claim. You told us what the in-service personal trauma was. Now we're going to look for credible evidence to help support the claim. And if there is no credible evidence in your file, so we look through your medical record, we look through your personnel file, and we couldn't find anything in there, we do accept examples of alternate forms of evidence. So we know that most of these claims go unreported You may not go to the doctor. You may not tell anyone it even happened. You just go about your day trying to move on. If you do happen to mention it to anyone else that's not, let's say in the military or family, you go somewhere, we do accept other forms of evidence, and here's a list of some of them that are most common that we find. So we have a rape crisis center or domestic abuse, a counseling facility or a clinic. This could be, sick hall in the military. This could be a hospital off base that you go to. You might, excuse me, tell the incident to any family members or your roommate. A facility member can be anyone, either at work, outside of work, at a medical facility. If you reported it to the police department and you tell us what police department that was, we can get the police report on your behalf. Medical reports from civilian physicians or caregivers. Again, if you go to a hospital or a clinic off base and you let us know, we can get those records. A chaplain or clergy, if you go to the chaplain and talk to him and let him know the situation, you can let us know that also. Fellow service members, as I said before, if you write it down in your diary, or if you keep a journal and, on a specific date, you wrote down that you went through something and you have that, you can submit that to us and that'll be considered as credible supporting evidence for your claim. Again, this list is not all inclusive. If you have other sources of evidence that you would like to submit, you're more than welcome to. We won't deny any evidence that you submit to us. If you have evidence that you want us to get on your behalf, again, you just submit the form, the 4142, allowing us to retrieve evidence on your behalf, and we will gladly get any information that you identify. Next slide, please. Okay, markers, and this should be a very important topic. If your service records contain no explicit documentation that a personal trauma occurred, and alternate sources of evidence do not provide credible supporting evidence of the trauma, evidence of behavioral changes around the time of and after the incident may constitute as a marker, excuse me, of personal trauma, PTSD stressor. The term marker means an indicator of the effect or consequences of the personal trauma on a veteran. A marker can be one or more behavioral events or pattern of changed behavior. So markers for us are really situational depending on what your stressor is. We look for changes in your behavior or attitude or your work ethic that we can say, this happened because this event occurred, okay? So for an example, let's say you were sexually assaulted on January 19th, 1990. On January 20th of 1990, so which is a day later, you failed your physical fitness tests for whatever branch you're in, the APFT, if you were in the Army. We could use that as a marker saying, well, the last 3 years prior to this date, the veteran did exceptionally well on her physical fitness tests. And then this year, after the date of the event she described, she failed. And that's not her normal behavior. We can use that as a marker to say that the traumatic event may have happened because we have no other supporting evidence. So when that happens, we'll use that marker and we'll set you up for an exam, and then the examiner will give the opinion if that marker is related to that event. And in that way, we'll be able to grant you benefits in absence of any other supporting credible evidence. Next slide, please. And here's just a list of other markers. These markers are not inclusive. There are many other forms of markers out there. It's our job to look for these markers. We are trained to look for these markers. Oh, I'm sorry. And so on and so forth. So again, here's some examples. Increased use or abuse of leave without reason, such as family obligations or family illness, episodes of depression, panic attack, or anxiety without identifiable reasons, visits to a medical or counseling clinic or dispensary without a specific diagnosis or specific ailment, use of or increased interest in pregnancy tests or tests for sexually transmitted diseases, including HIV, around the time of the incident. Sudden requests of the Veterans Military Occupational Series or duty assignment to be changed without any justification, changes in performance and performance evaluations. So again, a marker can really be anything. It's going to depend on every case because every case is different. So we look at every case differently. And this list is not all inclusive. I'm sorry. Next slide, please. I think that might have been it. Oh, we have more. Increase or decrease use of prescription medications, increased use of over-the-counter medications, alcohol or drug abuse, increased disregard for military or civilian authority, excessive behaviors such as overeating or undereating, unexplained economic or social behaviors, treatments for physical injuries around the time of the claimed trauma, but not reported as a result of trauma and or the breakup of a primary relationship. If we could just touch on the physical injuries, let's say, again, you were sexually assaulted, and this time it was rape, and from the rape, you have bruises on your back, on your knees, and on your face, and you go to the clinic and say you got into a fight. We can use that as a marker because you said in your statement to us that you got raped and you suffered bruises on your body. We can use that visit to the doctor, even though you didn't mention at the time to the doctor that you were sexually assaulted, as a marker to say these bruises, you know, could have been caused by this sexual assault. And that way, in the absence, again, of any other supporting credible evidence, we can use these markers to support your case and get you to the exam and the doctor. I see we have a question, and yes, it is. And I see we answer that. Yeah, so say where you were admin clerk at Fort Stewart and all of a sudden you put in a request to change your job. So you went from admin clerk to, let's say, a supply specialist, and you wanted to change your duty station, let's say from Fort Stewart, Georgia to Fort Drum, New York, out of the blue with no reasoning. We can use that as a marker to say, you know, after this date, she wanted to leave her duty station with no rhyme or reasoning. Why is that? So that will be a marker we can use to justify that this event may have happened. Okay, next slide, please. FSAD is female sexual arousal disorder, and as it states here, refers to the continual or recurrent physical inability of a woman to accomplish or maintain an ample lubrication, swelling, reaction during sexual intercourse. Decreased blood flow to the genitalia area is believed to contribute to FSAD, similar to the role of vascular disease in male erectile dysfunction. So we understand that veterans suffer other ailments besides mental disorders from sexual assault. So for women, one of the most occurrent ones is female sexual arousal disorder. So if you are suffering from this and it's due to your military sexual trauma, you can receive compensation for that issue separately. And if you are granted service connection for female sexual arousal disorder, you can receive what we call special monthly compensation for that. And special monthly compensation will grant you additional monthly compensation on top of whatever your rate is. Say you got 100%, and then we'll give you special monthly compensation on top of your 100%. One thing to keep in mind is that if you are service connected for female sexual arousal disorder at 0%, because 0% is still a percent for the VA, you can still be granted special monthly compensation at a 0%. So I just want you to keep that in mind. And the special monthly compensation you will be getting would be due to the loss of use of a creative organ. So that's both for male and females would get the special monthly compensation in that case. Next slide, please. And it looks like that was it for me. I hope that I gave you all some insight. If you have any questions or would like to contact me, I will leave my email address for Ms. Myers to distribute to you as she sees fits. And thank you for the opportunity for being here today.
Thank you for sharing a lot of good information. We truly appreciate that. Just want to hit on one thing that we kind of glossed over at the very beginning. Currently, there are 8 centralized locations that process MST claims. And those locations, ROs, regional offices, are Hartford, Lincoln, New York, which is your station that you're assigned to, Columbia, Portland, Nashville, Muskogee, and Indianapolis. So effective October 1st of 2021, the process was streamlined so that just 8 regional offices out of our 56 regional offices really focus in, and they are the main centralized locations that process these claims. Is there anything else that you could add to that, Daniel? That's about right?
Yeah, we started with 5, and then we increased it to 8. So we get claims from all over the nation, and they only go to these specific 8 sites, and they have to be worked by employees that are specifically trained to work MST cases. So like Ms. Myers said, New York is one of them, and I work there. So if any of you had questions about a claim, I would be the person to, like, say, go in the system and look at your claim and let you know if we're waiting on something or if we need something from you. It's only specifically trained individuals now in the VA that are doing those. So we take very serious care when we work these claims.
Thank you. And it does help, I think, to streamline the process overall. So again, thank you very, very much. In terms of veteran service organizations, just want to hit on that. If you are looking to put in a claim, if you need assistance through the claims process, it is instrumental that a veteran aligns themselves with an accredited, and let me say the word again, accredited, for the 3rd time, accredited veteran service organization. And here's just a few of those accredited organizations that are available within the area. American Legion, they are actually nationwide. Disabled American Veterans, another one nationwide. Specific to New Jersey, you have the National Association of County Veteran Service Officers, New Jersey Department of Military and Veterans Affairs. Then again, going back to nationwide, you have Vietnam Veterans of America and Veterans of Foreign War. Those are just a few. And you'll find that throughout the country in various states, they'll have state organizations. Just as you see for New Jersey Department of Military and Veterans Affairs, you'll have New York Department of Veterans Affairs. Each state should have a commission designed and set up to assist veterans, serving as advocates for our veterans. So again, the key word is accreditation. Accredited veterans via veteran service officers and organizations equals access to VA systems. You want to just make sure that your VSO is accredited, because if they're accredited, they are able to give you real-time information. They have access to VA systems, and they serve as a real good resource for our veterans. Next slide. So Daniel just discussed military sexual trauma. We talked about the centralized processing offices. We talked about the claims process for MST, markers, resources that are available to our veterans, i.e. veteran service organizations. Next slide. If you have any questions, you can go to va.gov. There's a benefits fact sheet, as well as contact the National Call Center at 1-800-827-1000. Next slide. So next, we're going to hear from Dr. Susan Black, who's going to speak to us about mental wellness and resiliency. Dr. Black? the floor is yours. But before I turn over the floor to you, just want to reiterate that all questions, we're not entertaining any questions verbally right now because we are taping this presentation. As soon as we conclude with all of the presentations, then we will unmute and we will engage in conversation, but we just want to protect your privacy and ensure that your privacy is protected again by muting everyone out so that only the presenters will be speaking. Thank you. If you do have any questions, please feel free to put them in the chat.
Ms. Myers, we have 2 questions in the chat that I can answer if you don't mind.
Yes, please.
Okay. Do you have access to our records from when we were in the service? Yes, we do. Once you file a claim, we'll do a request to get all your medical and personnel records. And if you have any current treatment in any one of the VA facilities anywhere across the nation, we can get those also. The 0% and still receiving compensation at 0%. Is this for medical claims too, or only MST? So I was referring to specifically special monthly compensation. There are certain conditions in which once you are granted a 0% will qualify you to get special monthly compensation. Specifically to MST cases, that will be ED for the men, and for the women, the FSAD. There are other conditions not associated with MST that you can get that for. I don't know that off the top of my head, but I can look it up and get back to you if you would like.
Thank you.
Okay.
And then I see, so VFW is not accredited for filing claims. The VFW is accredited. Please keep in mind when we talk about VFW, American Legion, we are not talking about the post. We're talking about the service organizations. There is a difference. So please keep in mind the service organizations are there to assist, if they're especially if they are accredited, they're there to assist veterans in the claims process and be a resource in other areas as well. If it's the post of VFW or American Legion post, that is more so for the social aspect. They are not set up to help in the claims portion. Okay. Dr. Brown, I'm sorry, Dr. Black, the floor is yours.
Thank you, Jennifer, and good evening, everyone. And thank you for the invite. It is a great, I find it as a great opportunity to talk about mental wellness and resiliency. Because when you're looking at mental wellness and resiliency, we have to understand the context of what individuals might have experienced or currently experiencing. And that's going to be key to maintain an overall health and well-being when you're looking at mental wellness and resiliency. Next slide, please. So as we are living through a global pandemic, there are some areas that we need to just be aware of, these areas that can have an impact on us when we're talking about our resiliency and our mental wellness. You're seeing some stats here, and this is a survey that was conducted by the American Psychological Association, a survey that they conducted in 2020 called Stress in America. And what it's showing is about 78% of Americans are saying that COVID is a significant source of stress, with 49% reporting that they have some negative changes in their behavior that has occurred. We are now into our 2 years, of going through this pandemic and this crisis that we're in. And so it is having an effect on us, and it's having an effect on our mental wellness and our resiliency. And that is important because, especially in the context of the fact that many of us are already living with the possibility of having some type of challenges prior to all of this happening, prior to this pandemic. So now to add an impact of the things that we're already been coping with, we have the impact of a pandemic that's occurring as well. Next slide. So when looking at stress and resiliency, because that's what we want to talk about. We want to talk about ways that we can maintain our resiliency at this particular time. So we do know that stress has a major effect on our bodies and our minds. We know that. We know that stress is our bodies and our minds' response to that demand or that challenge that we're faced with. So we do know that. We know that as part of our bodies adapting and adjusting to stress, that we have this fight, flight, or freeze response, or what many would like to call an acute stress response. And that's when our bodies and our minds get us into a position where we're ready to make a decision and we're ready to respond to just some of the demands and challenges that may be occurring and that we may be dealing with in our lives and in our situations. When you think about that fight or flight response, you can think about having a lion, and you have this deer, and when you talk about that flight, you see that deer doesn't have an opportunity, because instinctually, if there is a lion that's lurking behind a rock or a tree, instinctively that deer is not going to have to sit up and say, am I going to fight or flee? That deer is going to run. So it's just important to know that our body has that same type of response, whether we're dealing with a psychological threat or if we're dealing with a real danger. So when you're talking about that resiliency, and you have to understand what role that stress plays in our lives, and how we can cope and manage that stress is going to be very important. So what is resilience? Resiliency is that ability to successfully adapt. It's about being flexible. It's about recognizing that we have some strengths, and we have that ability to bounce back even when we're facing adversity and when we're facing challenges. So the more you practice resiliency, the more resilient you're going to become. So hopefully today I'll leave you with some tips on what you can do to remain your resiliency in your life at this particular point in time, and also in times to come. Next slide. So when we're talking about resiliency and we're looking at, mental wellness, we know that resilient people are able to cope with stress, right? We're able to cope with that crisis situation. We're able to adapt, and we're able to overcome. So resilient people find ways to bounce back in those adversities that are happening. But what's really important to understand for each of us is, what are some common stress reactions? And when we're under stress, how does our body respond? What are some of the responses that we may have when we're dealing with, just common stressful situations? And then you'll see here that, when you're under stress, that some people may notice that they're having some disturbances in their sleep. Oftentimes it's a lack of sleep, but sometimes people sleep more. They may notice some changes in their appetite, or just not having that energy, that lack of energy, and not wanting to do a whole lot of anything. They may experience some of those physical conditions, such as headaches and aches and pains and stomach aches, when they're just dealing with a lot of stress. And then you'll have those feelings of sadness, feelings of depression, anxiety, anger. These are all just common stress reactions that many of us may be dealing with as we're navigating through what's happening currently with the pandemic, and also challenges that we faced in the past in our lives. So just important to know how your body responds to stress. What is some of those reactions, and so that we can be prepared to make those steps that we need to take when it comes to our resiliency. Next slide. So what are some strategies that we can use to remain resilient? To become more resilient, these tips can be very helpful for you, especially during this time. Resiliency is like a skill. It's like, riding a bicycle. The more you practice the skill, the better you become at it. And the more that you're in tune and in touch of how your body reacts to stress, the better off you'll be of understanding that, yes, I am undergoing stress, and I'm aware of that. And here's some things that I need to do to make sure I maintain my resiliency. Of course, eating is so important. We know that. We know that throughout this time, and for a lot of us, when we go through a lot of stress, sometimes we look at some weight gain. I can tell you, during pandemic, during COVID, there has been some increases in weight. On average, most people have gained about 30 to 35 pounds. And that is what we're finding out through research. So, some of us cashed in on this pandemic in COVID, and we did see some of those increases in weight, in those weight increases. So, and that's just a sure sign that, we're probably, dealing with some stressors and some stress that's going on. Getting enough sleep, that is so important. That is so critical. Sleep is so important because when you're not sleeping, you can't make those decisions that you need to make. You don't have that ability and those sharpened skills that you need. So sleep is critical. 8 hours of sleep is what everyone recommends getting. During the pandemic, some of us got more sleep, but a lot of people are having a lack of sleep. And a lot of that has to do with some of the stresses and the worries and the anxieties that they're having going throughout this pandemic. So very important. Exercise and just being physically fit, physically active. A lot of us are still sheltering in place. I mean, on the Stress in America survey, there's still so much uncertainty that's going on. A lot of us are still going through a lot of that. So we are trying to just cope with that. And so many of us are still working from home and, trying to make sure you include that exercise and that you're moving. It's so important. Getting out. I mean, I know the weather has changed now, but, jogging in place, just making sure that you can become more physically active is going to be so important when you're talking about being resilient. We know that we're still in a pandemic. So the things that we can do to maintain that resiliency and to regain that resiliency is going to become so important. Finding ways to relax. This is so key to any type of resiliency, is understanding when you're under stress, understanding when you're facing challenges and knowing what to do to get your body back into that relaxation stage. We talked about that fight, flight, or freeze response. And as you can imagine, that when you're under stress and you're trying to make those decisions that you need to make, you're probably a little hypervigilant. Your emotions, your reactions are still there. So finding ways to get yourself back into that relaxation mode is going to become so important. And that's why finding those ways to relax, whether it's meditation, deep breathing exercise, works very well when it comes to trying to get to that relaxation stage. And then we have that mindfulness, practicing mindfulness and mindfulness meditation. And that is just, taking some time to focus on the present and just being present for that moment. And having those self-calming, soothing talks to yourself is a great way to help you to remain resilient during any type of situation that you're finding and those challenges that you may find. That self-compassion and that gratitude, just being grateful with the situations that you can be grateful for, are some great ways when it comes to just making sure that you can keep yourself into that relaxation mode and become more resilient as you're going through all of the challenges that we're facing. Having fun, that's also important. Hobbies, some people took up a hobby. I have some friends who decided that they wanted to learn how to play the drums recently. So hopefully they'll find some soothing, music in that. But I know in the beginning, as they're trying to look at this new hobby that they're doing, it'll take some time, but at least they're moving and they're trying to engage in those activities that's going to include some type of, that's fun for them. Connections are so important. Connecting with family members, connecting with friends, great way to remain resilient. Having that support system that you can stay in touch with, that you can talk to, that can also help you when you're facing challenges. So important having the social connections. I know with COVID, a lot of us talked about that being socially distanced. And I say, yeah, we needed to be physically distanced, but we still need to maintain those social connections. So important. Avoiding alcohol, substance misuse is important. We saw in the research that we saw a lot of increases in substance use as well as we went through this prolonged pandemic. So it's important to not use those things because we want you to be able to cope and not have another problem when you start using substances. And of course, focus on what you can control and practice acceptance. That is So important. That's, focus on the things that you can control. That's part of that serenity prayer, right? So just focus on those things that we can focus on. And then those other things, we just have to know the difference of some things that we just have to accept and remain calm and practice our mindfulness and our deep breathing exercises, and just continue on as we endure and we try to find that resiliency. Next slide. So when do we need to seek help? I explained just some of the stress reactions that we all can be facing now and how our bodies may be adapting. And we talked about just some ways of remaining resilient, but I'm also aware of the fact that some of us may be at a point where we're really struggling. And although we've used all of the stress management, the coping mechanisms and tools, we still may be finding it very difficult to adapt and adjust currently. And so in those particular cases, when you are finding it very difficult and your symptoms of stress, they're continuing in spite of everything, that's the time when you need to see your doctor. For mental health, if you're finding yourself where you're really distressed, or if you're not functioning well, or if you're having thoughts of self-harm, that's when we want you to seek help. And we want you to seek help immediately, whether it's your physician, your doctor, or if you seek help in an emergency department, we want you to seek help at that particular point in time. Having an appointment with your family physician or your primary care manager is important. I can tell you, research is also showing that a lot of us have not made our regular appointments, our regular physical health appointments during this time. So, getting in to see your doctor if you're struggling or having a hard time adjusting and coping with stress is going to be so important as well. Next slide. So here are some resources that's available to you. And hopefully we can add some of these links so that you'll have them. Don't wait, reach out. That is excellent. A website that you can go to. It's a website that we have with the VA. And what it does is it gives you that opportunity. It's very interactive. You go in, you'll click on the page, and like, for instance, if you're having difficulties with depression, you'll be able to click that you're having difficulty with depression, and then it'll give you all these resources that's available in your local area. So very excellent website to use, just as we're coping and trying to maintain our resiliency and our mental health. VA mental health, there's a lot that's available on that website. Make the connection, coaching into care. So there's a lot of resources that's available for you that you'll be able to use and utilize just as a resource as you continue on with your resiliency. Next slide. And some of my favorites is we do have some apps for managing stress. The Department of Defense and the VA has these apps that are available that's very helpful. Breathe to Relax. It takes you through just some deep breathing exercise, progressive muscle relaxation, just things that you can do where you can practice mindfulness. You can have an opportunity to practice deep breathing. There's a virtual hope box, PTSD coach, and a COVID coach app that is very helpful, gives you kind of like a tip for the day, things that you can do to maintain your mindfulness, being aware, and your resiliency. So some really good resources that's available. And I encourage everyone to just take a look at those. I know many of us may have these iWatches where we have a breathing exercise or a breathing app on our watches, and just have some time, a couple of times out of the day, to just practice mindfulness or those deep breathing exercises that will really do a lot in helping you to maintain that resiliency and helping you to recenter and refocus throughout your day. Next slide. And of course, we have the Veteran Crisis Line and the Military Crisis Line, also the Suicide Prevention Lifeline. This is all the same exact phone number that you can contact. It's just that if you're a veteran or a military member, press 1. But this is confidential, free confidential counseling services that's available 24 hours a day. If you're finding yourself in the middle of the night needing someone to talk to, or feel like you're in a crisis, this is available. This is a resource that's available. The 1-800-273-8255 number Get a chance, put it in your phone, if you have any friends or relatives who may need this phone number, it'll come in handy. So if you have that number, if you can get that in your phone, that can be very helpful. Next slide. And here is just contact information that's available for me if there's any questions, or if any questions that come up later on. If you want to send me an email, you can do that as well. And Jennifer, I think that is all I have.
Wow. Well, thank you. A lot of good information. Thank you, Dr. Black, for sharing that with us in regard to mental wellness and resiliency, especially during these times as we are going through COVID and just going through day to day. It's just good information to have. And if you could, Elizabeth, if you go back one slide, please. Go back. One more. That slide. Yes. No. Go forward. Okay. That 1-800-273-8255. I would highly encourage everyone to put that in their phone. You never know. Just as Dr. Black mentioned, you really never know. And you just might be that one person that can help someone through just sharing that number with a friend, with a fellow service member who may find themselves in need. And sometimes we just say, well, what can I do? Well, here's what you can do. You can offer them this phone number, and that could possibly make the difference. So please, if you can, jot that down, put that in your phone. And nowadays it's so easy to share numbers, share that contact. Hey, I'm gonna text you over this contact information, and within seconds it's in the hands of somebody who's in need. So very helpful. If you can, I'm hearing someone conversation. If you could please mute your phone. Is everyone on mute?
It's crazy.
Okay. I'm sorry. There's someone who has an open mic or open phone. If you could please mute your phone. This presentation is being recorded, and we would not want to have your conversation being recorded as well. In addition to muting your phone, we're asking that everybody please turn your cameras off as we are taping this presentation portion. Once we're completed with the presentation portion, we will then ask for you to unmute, and then we will engage in open conversation. So far we've heard from Daniel Feliciano, and we've heard from Dr. Black. Next, we will be hearing from Scott Dadaian from the Sea Caucus Vet Center. He will share some information with regard to services and resources that the Vet Center offers to veterans and their family members. Scott, the floor is now yours.
Thank you, Jennifer.
And if you could forward the slides, there's a Vet Center slide. Elizabeth.
I think it's two forward.
Yep, there you go. Vet Center.
I don't
Thank
have
you.
a bunch of slides, so no death by PowerPoint from me. So I am Scott Dadaian. I'm the Veterans Outreach Program Specialist here at the Sea Caucus Vet Center. Here in New Jersey, we have 5 vet centers: Sea Caucus, Bloomfield, Trenton, Lakewood, and South Jersey, which is down in Egg Harbor. There are 300 vet centers across the country, ideally nearby VA medical centers. And our function, our mission is providing counseling services, mental health treatment. From our creation, we were originally established to treat combat PTSD in Vietnam veterans. And over time, that expanded to recognize needs in other populations. So first it expanded to other periods of conflict. And in the late 90s, there was an acknowledgement that we should use our skills and our counseling expertise and our staff to treat MST survivors. So one important thing to note that I think we may see more than any other part of the VA, at least initially, is that MST is not a gender-specific experience. There are male survivors as well as female, somewhat shifting towards the past when the military was all or mostly male, especially those in the combat areas. So in my time here, in the 5 years I've been working here at the Vet Center, I've met a few men who were comfortable talking about their experience through coming to terms with their experience and getting into therapy and wellness practices as part of their recovery. So it was something that expanded my viewpoint somewhat, you could say. But for the most part, in the modern military, we're seeing that women are often the targets of those type of attacks and experiences. And so all VA type services and support have that in mind, the way that military culture and even veteran centric environments can be triggering for what someone may have experienced. So when we're contacted by a veteran who's interested in counseling services, there's no need to explain why you're calling, especially to anyone who's not identified themselves as a counselor. So our staff consists of an outreach representative like myself, an office manager, counselors, and a director. The only clinical staff are the counselors and the directors. So although any information shared with any of our staff is kept confidential, there's no need to explain details of anything with anyone that you're not comfortable with. So the general phrase that I recommend veterans say when they call interested in scheduling an appointment is, I'm a veteran and I need to talk to someone. We get you in touch with a counselor or the director as a referral, and whoever makes the first initial contact will ask some screening questions to get that information. Normally, like I said before, our primary population that we see are combat veterans, Vietnam, OEF, LIF primarily, and then everything in between. So sometimes there's a sense of the vet centers are for combat vets. And that comes sometimes from within the VA as well, just because that is our initial mission, our primary mission in a certain sense. But it's really important to make sure people are aware that MST is not even secondary. It's like a 1B priority in what we're charged to do. In some cases within other branches of VA, having bad paper discharge can be a limitation in accessing benefits. Excuse me, with vet centers, that's one of the last things we're concerned with, because we've seen in the past the chain of events where a service member undergoes a physical assault of some kind. Excuse me, they might report the incident and then they are discharged rather than the abuser. And in some cases, it's a dishonorable or something that's permanently damaging. So from the vet center point of view, we know that can happen. So we don't have any restriction on discharge class. Under normal circumstances, that dishonorable is an issue, but when it's an MST survivor, we can ignore that. And one of the first things we'll do, excuse me, regardless, is try to help advocate for a discharge upgrade. So not only does that help remove that blemish on one's service history, but it opens up the door to other VA benefits as well, without having to go into detail about someone's personal experience. So what do we do as part of the therapeutic, I was trying to say therapy and therapeutic at the same time, as part of the therapy for MST. Well, MST is a form of PTSD. The symptoms and effects on the person are very similar. It's just the nature of the traumatic event is different from what you see with combat vets or people who survive accidents or training misfires, things like that. And so the nature of the trauma is different, but the support needed and ability to provide tools that the person can use, like Dr. Black was talking about, to help get through the symptoms of what's going on. That's somewhat the same. Some of the differences that we see, there could be issues with an ability to form or maintain relationships. That's not too different from combat PTSD, but the reason why is different. So there would be encouragement to talk that through. If there was a relationship that was in undergoing difficulty, we have the benefit that we can extend services to anyone within the veteran's family. And family is a loosely defined term. It's not legal family that can be proved on a piece of paper. We can treat boyfriends, girlfriends. We can treat best friends that, as far as the veteran is concerned, that person is their family. It doesn't matter. How is that person part of your overall support system? And how does what you are experiencing and what you're going through affect that person? So we've been able to provide couples counseling, family counseling to a whole family unit. We counsel children of veterans, and we've counseled parents even who their child comes home, adult child obviously, that comes home from service, and the parents are concerned and that relationship is strained. The veteran wants it to be improved. We can extend our support to the parents as well. So it's a layer of service that we can provide that's in addition to what other VA mental health services can provide. What we do is separate from the claims process that Daniel was talking about earlier. Although if a veteran is seeing us for counseling related to MST, you can use vet center records as justification of treatment for the symptoms and experiences that you're living with. So what's somewhat different about the vet center than other VA hospital or VA clinic mental health services, when you file a claim, VA claims officers can pull your VA medical record. So those things will be included in there. Vet center records are not. We keep them completely separate from the rest of your VA treatment history. So it's good in that if someone wanted it to be kept away from their VA medical care, you can. It's bad in that it adds a step to adding those notes into the proof required for a claim. But simple enough, if you want to use vet center treatment records towards a claim, you fill out a release authorizing us to share it with VA in reference to your claim. When we get the request from VA, we send the records out, and that's it. The last thing I'll say about our counseling service is probably the most important. A lot of times in mental health, especially in the private sector, time limits are placed on how long you can be in treatment. You hear like 8 weeks for depression, 12-week anger management course. And when you're dealing with insurance, they tend to put a limit on how long it should take you to cope with that issue, whatever it might be, which is counterproductive to how mental health works, but that's a different discussion. Vet centers do not have a time limit on how long you can utilize our services. We exist and are available to you as long as you need us. If you feel that you've made progress and you say, yeah, I think I'm okay, you can stop with your counselor and be on your own, so to speak. But should it ever get to a place where you feel you need help again, you can call us back up. Yeah, I was doing okay and now I'm not. Okay, no problem. May not be able to match you with the same clinician you were seeing the first time, depending on multiple things that could happen with staffing, but it's not an issue of, well, we saw you for this long the last time. No, doesn't matter. So we lovingly refer to ourselves as the best kept secret in VA. I know Jen Myers will echo that. That's our favorite tagline. I forgot to add also, vet centers are positioned in the locations we are separate from VA medical centers so that it's a different environment. Going into a VA medical center or any hospital type setting for mental health is sometimes off-putting for people, not just in cases of MST. Any individual, veteran or otherwise, may not be comfortable going to a hospital type medical setting for their counseling services. So all the vet centers here in New Jersey, I know for sure, I think across the country, are located in either their own building or as part of an office building. And it's a friendly, comfortable setting. We have pictures up on the wall. It's not that standard white or tan paint that you'd expect in a medical setting. Every person's office is welcoming, with couch and furniture and all that. You'll have personal effects to represent the counselor, not just as a VA employee, but a person that making a personal connection with the client is really important. Without a trust between the veteran and their counselor, it's almost impossible to get any kind of growth. So, the person coming in for help needs to first and foremost feel comfortable and safe. So we try to establish that environment with the way that the centers are structured and appear, and that taking the edge off, taking some of the anxiety away of walking into this unfamiliar, uncomfortable hospital setting. If that's not there, it becomes a little bit easier. If you have any questions, there's a couple ways. I'll check the chat also. But there are a couple different ways to contact us. The VA website has a vet center page, www.vetcenter.va.gov. Vet center is all one word. And from there, you can use a locator feature that'll show you any vet center in the country. For us here in Sea Caucus, and I'll write the number down in the chat. Our phone number is 201-223-7787. For me personally, if you yourself or you knew a veteran who could benefit from our service, I'm fine having anyone contact me, and whether Sea Caucus or another vet center is most accessible, I'm not worried about which location somebody uses so much as they're getting the help that they need. Right now, we were about to go back to seeing people in person, and then January happened the way that it did, and we're back to strictly virtual. But we're hopeful that being able to see veterans face-to-face in person in the center is around the corner. But in the virtual setup that we're using right now, location is not so much of an issue. You're accessible to any counselor via technology, so that's a benefit. Although there is something lost in doing therapy through a camera, but it's better than having nothing. So like I said, I'll include contact information for me in the chat. I'm just going to check this here for any questions.
There was a question in the chat, if you can address that.
I see. I don't know. The family has been, the extension of family has been at least 5 years that I've been here, and I think even longer than that. The recent change to our eligibility included, last year, there was an expansion to include National Guard soldiers who were activated on state orders. The primary reason for that was for everyone activated for the COVID missions. But it also included natural disasters, acknowledging that there's a pretty significant chance you could experience a traumatic event on either of those type missions. So it was a way that we could extend support to National Guard soldiers that really didn't have any alternative for seeking counseling other than using the on-base through the medical unit in Seeger, at least here in New Jersey. And then this year, I believe it just got approved and put into our policy. And I don't know the details inside and out yet, but there was provision for us to extend services to reservists. In the past, we were looking for, with Guard and Reserve units, we were looking for a federal Title X activation into either combat or combat support. So any deployment to Jordan, Djibouti, that was in support of Operation Enduring Freedom or Operation Inherent Resolve, any of those, we could establish the combat support component of our eligibility through that. Now it's extended to reserve, and we're still gathering the details of what that means and how we can enact that. In general, my suggestion to any group that I make a presentation to, if you're interested in counseling services, contact us. The very worst case that we would do is try to set up a warm transfer to VA healthcare if the veteran was eligible, or try to find a provider in the community. Above all else, all of our licensed mental health providers, our clinicians and our directors are bound by their license to do no harm. So if someone calls saying that they need help, we can't just say, well, you're not eligible. So we have provisions in place to be able to extend support if that's the only option, while we try to locate something that would be more appropriate or able to support the veteran. 9 times out of 10, we're able to establish eligibility in a session or two, and it's not an issue. So that's why I always recommend, if the interest is there, call and raise the question, and at the very least we can see you for a few visits while we try to help lock something down for you that can be a continuing experience from there.
Scott, can you talk to character of discharge? Is that a factor when making a decision as to the type of services your office could provide, vet centers can provide?
It is not. Recently, I think it was last year, there was an asterisk placed on one of our documents that said a dishonorable discharge. The first thing we're supposed to do is try to work with the veteran to get a discharge upgrade. But in a case of MST, we're not going to withhold services, counseling services for a dishonorable, especially when you consider how long it takes to request an upgrade from the DoD. So it used to be just across the board. No, there was no restriction on character of discharge. Now dishonorable has some level of hold on, pause, let's see. You're supposed to go after an upgrade first. I will say also with VA mental health through the hospitals, character of discharge is not an issue either, again, except for dishonorable. Under normal circumstances, if you had an other than honorable or a general, it could disqualify your eligibility for VA healthcare, except for mental health. In that case, there's a special provision eligibility that can be extended to provide mental health support as needed. And then usually, if everything is worked out in the way that you may expect, you can establish an event in service that can then be claimed, then they're service connected. Now they're eligible for healthcare. So it ends up being just trying to find the right pathway.
Okay, thank you. That's very helpful.
You're welcome.
And I don't see any other questions in the chat. So with that all being said, again, just to echo, Vet Center, best kept secret, best kept secret. Awesome. So at this time, I want to take the opportunity to thank Mr. Feliciano from the New York Regional Office, Dr. Black, Mr. Dadaian from the Secaucus Vet Center for sharing information during the presentation portion of this seminar. We will now conclude the recording portion and will unmute mics for